This is your fetal pig. This is going to be part of your lab test, but not all of your lab test. And I won't necessarily tag everything that I'm going to go over with you. I'll tag some of the things that I'm going to go over with you, but you need to know all of it. So starting up here in the mouth, you got the hard palate, you got the palatine raphe, you got the soft palate. The opening in here is called the glottis, and the flap of tissue right here is called the epiglottis. Obviously, this is the tongue. Okay, that's what you need to know about the oral cavity. We close that up. Let's open up the neck. You got the trachea, or excuse me, you got the larynx. You've got the trachea. Okay, always look for the rings on the trachea. I don't want to see anybody putting down esophagus for this. I'll strangle you myself. Okay, we come back here, and this is the way if I test you on the esophagus, it's going to look. Is I'll take the probe, and I'll put it up underneath like that. There'll be a pin in there, and I'll say, name that structure. So I'm looking for esophagus. All right. Or I'll put a pin in here. I'm looking for, thyroid, trachea, larynx, trachea, excuse me. Okay? Now, on either side of the trachea, these two lobes, that's going to be your thyroid gland. Okay? Your thyroid gland. Okay? Now, we take a look here. We've got this massive tissue, and this is the thymus. I cut it in half so I can expose the heart, and this tissue here is the pericardium. Okay, that's the pericardium. Here's your thymus. We pull that apart, and obviously you got the heart. Now I'm going to test you on the heart, the bigger hearts, not necessarily this, but I put a pin in that and say, name this structure, name this organ. Make sure you put down heart. I can't tell how many times how I get stomach. Okay? I get stomach. Okay? It's a heart. Okay? All right. You got your lungs. Notice the size of the lungs. Okay? This is your left lung. We know it's your left lung because it's got 2 lobes. Your right lung, it's got 3 lobes. Okay? So, your lungs. All right? This is the diaphragm. We reflect the diaphragm back. And this is the liver. Don't give me stomach if I ask you about the liver. Okay? Know the difference between the two. This is a real dense, solid organ. We flip the liver up. Come on, get around here with your iPhones. Yeah, smack me in the head with it.
The gallbladder.
This is going to be your gallbladder. It's in the gallbladder recess, the gallbladder depression of the liver. That's right there. Okay? This is the stomach. Okay? This is the stomach. Okay? Big difference between the liver and the stomach. Okay? Now, this thing that I just threw back here, this is the spleen. Okay? Remember, the spleen's going to look like a tongue. Okay? Spleen looks like a tongue. Flip that back, and this is real nice here and real clear. This glandular-looking tissue, this is the pancreas. See how it's kind of yellow? Okay, that's the pancreas. Now, the first part of the small intestines that comes out of the stomach, this is the duodenum, or for those of you who prefer English, the duodenum.
Yes, that's the way we like it.
Yeah, that's the way you like it. It's both spelled the same way. All right? Now, from the duodenum, you get into the small intestines. Okay? I'm not going to ask you which is jejunum and which is ileum. I don't care. Not here. And then this curlicue portion here, this is the large intestines of the pig. Okay? Now, then we come down around here, and you've got, this is the cecum over here, but I'm not going to ask you about the cecum and all that. This is your rectum, comes down this way. Okay? This is your kidney. Okay? This is your kidney. This is the ureter as it comes out of the kidney. See that? The ureter as it comes out of the kidney. Notice the ureter goes into the urinary bladder, which is going to be right here. Okay? Goes into the urinary bladder. This is the ureter on the other side, and your other kidney. Now, in this particular case, this is a female pig. These are your ovaries, which are these little dark-colored organs. And these are the fallopian tubes. Okay? That's what you need to know about the pig. Any questions?
All we missed was the small intestine, large intestine.
I didn't miss it.
No, my thing started.